You may be asking yourself, what is chiropractic and how does it work? Did you know that chiropractic care is the world's largest alternative healthcare profession? Since its founding over a century ago in 1895 by Dr. Daniel David Palmer, it has evolved significantly, with advancements in both science and clinical practices. Manual manipulation of the body has a rich history that spans thousands of years and across numerous cultures, long before Dr. Palmer formulated chiropractic care. In ancient Greece, Hippocrates, often regarded as the father of medicine, emphasized the importance of the spine in maintaining health. He famously stated, "Get knowledge of the spine, for this is the requisite for many diseases," and developed techniques to realign the spine, integrating these methods into Greek medicine to address musculoskeletal issues. In ancient China, spinal manipulation was a key component of traditional Chinese medicine, with practices like tuina combining massage, stretching, and spinal manipulation. These techniques were used to balance the body's energy, or qi, and promote healing, reflecting a belief in the central role of the spine in overall health. Similarly, in Africa, traditional healers known as bone setters practiced manual manipulation to treat dislocations, fractures, and other physical ailments. Their holistic approach often included both physical and spiritual elements to restore harmony within the body. Other cultures also contributed to the legacy of manual therapies. In ancient India, Ayurveda incorporated manipulative techniques for spinal and joint health as part of its broader system of holistic medicine. Native American tribes, too, utilized manual therapies performed by medicine men or women to realign the body and treat injuries. These ancient practices laid the groundwork for the development of manual manipulation as a healing art. When Dr. Palmer introduced chiropractic care in the late 19th century, he built upon this rich heritage, formalizing spinal manipulation into a distinct healthcare discipline. By focusing on the relationship between the spine, the nervous system, and overall health, Palmer's approach combined age-old manual techniques with his innovative theories, establishing chiropractic as a unique and modern practice. Dr. Palmer, widely recognized as the founder of chiropractic, laid the groundwork for this healthcare profession in the late 19th century. Influenced by a holistic health philosophy, Palmer emphasized the body's innate ability to heal itself without reliance on drugs or surgery. Through careful observation and experimentation, he explored the connection between spinal misalignments, known as subluxations, and various health conditions. Palmer developed the concept of spinal adjustments, a refined method of manipulation, as a means to correct these misalignments. He theorized that such corrections could restore proper nervous system function and improve overall health. In his clinical practice in Davenport, Iowa, Palmer documented numerous cases where spinal adjustments reportedly alleviated ailments and enhanced well-being. In 1895, Palmer published his findings and principles, formally establishing chiropractic as a distinct healthcare discipline. He also began teaching his techniques and philosophy, founding the Palmer School of Chiropractic to educate others and promote the profession. His efforts to formalize chiropractic education helped shape it into the recognized field it is today. By combining his holistic perspective with innovative approaches to spinal care, Dr. Palmer not only developed the foundational principles of chiropractic, but also paved the way for its growth and acceptance as a vital component of modern healthcare. Now let's hear Dr. Moran provide a straightforward explanation of how chiropractic care helps restore and maintain health, enabling us to achieve our best quality of life.
Hello, I'm Dr. Moran. The most effective way that I feel I can explain chiropractic is to compare it to things that we see in our everyday lives. So let's explore that together. Imagine a building. A building is a structure that is governed by the laws of physics. And so, its stability is dictated by the mechanics of the structure and how the forces of gravity and external forces from the environment affect it, such as wind, rain, temperature, etc. Similarly, the human body is also governed by the laws of physics, and its stability is dictated by the biomechanics of the structure and how the forces of gravity and external forces from the environment affects it, such as temperature, stress, social interaction, accidents, etc. The human body is additionally affected by internal forces such as posture, joint dysfunctions, nerve dysfunctions, the foods that we eat, exercise, the poisons or medications we absorb, emotions we experience, etc. A strong building requires a solid foundation, typically made of cinder blocks and mortar. The blocks provide structural support while the mortar holds everything together. If the blocks are misaligned or the mortar is weak, the structure is compromised. A poorly mixed mortar or improper application increases the risk of structural failure. For example, if the mortar is too dry or applied incorrectly, the wall is more likely to fail over time. Look at the difference between these two walls. In one, the mortar is too dry and applied improperly. Over time, this wall will have a greater propensity for failure. Now think of the human body in the same way. The fundamental building blocks of our body are cells, primarily made of protein. The mortar that binds these cells is the nutrition we acquire. Proper nutrition consists of macronutrients, carbohydrates, proteins, fats, water, and fiber, and micronutrients, vitamins and minerals. One crucial macronutrient, protein, is the foundation of life. It consists of amino acids that the body uses to repair and create new cells. Collagen, a type of protein, provides structural support much like the steel girders in a building. If a person's diet is poor, consisting of processed and nutrient-deficient foods, the mortar weakens, making the body vulnerable to illness and degeneration. Just as a building with a weak foundation is susceptible to damage, a body lacking proper nutrition is more prone to disease and disability. On a larger scale, a building's foundation supports everything above it. In the human body, the foundation begins with the feet. The skeletal and muscular systems rely on the feet for stability. When the foundation is unstable, it leads to postural imbalances, joint dysfunction, pain, nerve dysfunction, and potential disability. In a healthy foot, there are 3 arches: the anterior arch, the medial arch, and the lateral arch. Arches are inherently strong structures. Similar to arch bridges that distribute weight efficiently, an arch bridge is more durable than a beam bridge because the arch disperses weight outward to the supports. A beam bridge has a weak center point, and therefore it requires more vertical reinforcements. The arch design spreads the load across its supports, preventing collapse under pressure. Similarly, the arches of the foot work together to balance the foot, distribute the body's weight, and dissipate the forces of gravity while walking, standing, or running. This is not so different than how a shock absorber in a car allows its occupants to experience a smoother ride. The shock absorber dissipates the stress in a similar manner to how a foot with a well-established arch dissipates stress. In contrast, a bicycle, which relies solely on its tires for shock absorption, transfers more impact to the rider on rough terrain. By the same token, flat feet, without proper arch support, expose your body to similar harsh, jarring forces. If one or more of the arches collapse, the biomechanics of the foot changes, causing a ripple effect throughout the body. Arch collapse causes the toes of the foot to rotate outward. This outward rotation triggers a compensation at the ankle joint, causing it to rotate inward, producing an overpronation of the foot. This inward pronation of the foot causes the knee, which normally bends like a hinge in one direction, to abnormally torque, creating a damaging shear force that results in joint damage and pain at the level of the knee. The postural compensation doesn't stop there. It extends up to the hip, causing abnormal rotation within the hip socket, also known as the acetabulum, which leads to stress, strain, and further joint damage to the hip joint itself. The hip on the affected side will drop from level compared to its counterpart on the opposite side of the body. This pelvic unleveling results in the shoulder and upper body to compensate by leaning in the opposite direction. This chain reaction of compensations leads to further damage and pain throughout the body. Now that you have a firm understanding of how the body's foundation works, let's examine how chiropractic plays an integral part in the development, restoration, and healing in the human body. Your body is an electrical system. Actually, it's an electrical chemical system. And that is another reason why nutrition, vitamins, and minerals are essential for proper health. Minerals such as calcium, potassium, sodium, and gases such as nitrogen, oxygen, and hydrogen, as well as other elements, have electrical charges. This sample is only a small group of the elements that are utilized by the body that must be in proper proportions for the body to become and remain healthy. When doctors examine your heart, they do an EKG. The EKG records electrical signals generated by the depolarization and repolarization of the muscles as the heart beats. In a similar manner, when doctors examine your brain, they do an EEG. The EEG is a reading of the electrical activity resulting from the depolarization of many neurons. All electrical activities in the body, including the depolarization of neurons that contract your muscles, as well as signals that are sent to and from your brain, are all governed by the elements in your body that are either derived from what you were born with, what you eat, or what your body manufactures from sunlight. Your brain is the master control system of your body, and it is vital to your survival. That is why it is encased in bone for protection. The brain takes electrical signals from your body, interprets these signals, and sends corresponding electrical signals back out. It does so with your spinal cord, which is a direct extension of your brainstem. This direct extension of the brain transmits signals via the nervous system, ensuring proper function. The spinal column, also known as the vertebral column or backbone, is a bony structure made up of 33 vertebrae. It encases and protects the spinal cord while serving as the body's central support system. Beyond providing stability, the spine allows movement and safeguards essential nerve pathways. Intervertebral discs and facet joints within the spine act as cushions, enhancing flexibility and shock absorption. Without these structures, our spine would lack mobility, functioning more like a rigid turtle shell, offering protection but no flexibility. The nervous system functions much like an electrical system in our homes. The brain is the power source, nerves act as wires, and the spinal column serves as a circuit panel distributing energy. Each segment of the spinal column goes to a particular region, to a particular organ, affecting a particular function. Circuit panels in homes divide wires to go to particular rooms for particular functions. For example, a circuit in a house can supply an outlet or a ceiling fan. In a house, a circuit breaker is either on or off. In the body, however, the spinal column at each vertebral level acts more like a dimmer switch that can either decrease or increase the amount of electrical signal dependent upon the nerve dysfunction, or according to the latest research by Dr. Heidi Havok, by the dysfunction in the area affecting the multifidus muscles. The multifidus muscles are small but powerful stabilizers that run along your spine, connecting one vertebrae to another from the base of your spine all the way up to your neck. They play a vital role in keeping your spine stable and aligned during movement. These muscles work quietly in the background, consistently helping to support your posture and protect your spine from injury. One of the most important jobs of the multifidus is to provide your brain with constant feedback about where your spine is in space. They're packed with sensors called proprioceptors, which help your brain coordinate balance, movement, and body awareness. They don't create big movements, but instead fine-tune and control the small, precise motions between each spinal joint, almost like the fine-tuning knobs of a musical instrument. When there's a problem in the spine, like a joint that isn't moving properly, known as subluxations, the multifidus can become inhibited or turned off. This means it stops sending clear signals to the brain, which leads to poor spinal stability and communication issues between your brain and body. As a result, you may experience stiffness, poor coordination, or even symptoms in other parts of your body, like sciatica or muscle weakness. Even more importantly, this disruption in spinal input can also affect the autonomic nervous system, which controls things like digestion, heart rate, breathing, and organ function. Since spinal segments are connected to the autonomic nervous system that help regulate these systems, a subluxation can create imbalances not only in movement, but also in the internal function, sometimes showing up as fatigue, digestive problems, or stress-related symptoms. That's one of the key reasons chiropractic care is so effective. When we adjust the spine and restore normal joint motion, it helps reactivate the multifidus muscle and reestablish clear communication with the brain. This not only improves posture, stability, and coordination, but it can also help normalize autonomic function, supporting better overall health and reducing symptoms both near and far from the spine. Suppose someone has joint dysfunction at a particular area of the spine that causes a signal to be decreased to a particular area. This may be interpreted by the individual as numbness in the foot. The problem is not in the foot, but the patient perceives the numbness as if it were. When chiropractic care corrects joint dysfunction, the root cause of the issue, it restores normal nerve signaling and joint mobility, allowing numbness in the foot to resolve. However, if someone relies on pain-relieving medication to block the signal to the brain, the joint dysfunction remains. Over time, this can lead to degeneration, arthritis, and recurring flare-ups of symptoms throughout their life. In a similar manner, if nerve dysfunction is affecting the signal from another area of the spinal column that innervates an organ, it could be any organ, but let's use the stomach as an example. This may result in heartburn due to decreased acid production from decreased nerve supply. While taking an antacid may temporarily relieve heartburn, or even worsen it, it does not address the root cause, joint dysfunction and abnormal nerve signaling to the stomach. Taking antacids when stomach acid is already low can provide little to no relief and may even worsen the problem by further reducing acid levels. This can lead to complications such as poor nutrient absorption and bacterial overgrowth. Antacids work by neutralizing stomach acid, but in cases where acid is already deficient, they only compound the issue. Many people assume that over-the-counter antacids are harmless, but prolonged use can contribute to serious health concerns, including kidney and liver problems, digestive dysfunction, and imbalances in calcium levels. Instead of masking symptoms, chiropractic care addresses the root cause, joint dysfunction, allowing normal nerve signaling and stomach acid production to return. This supports the body's natural ability to heal and function optimally. Now, I'm not saying that all cases of heartburn stem from spinal nerve dysfunction, but if joint dysfunction is the underlying cause, no amount of medication will truly fix the problem. And that's how many chronic health issues develop. People simply aren't educated on how the body actually works. If you're wondering why your family doctor hasn't explained this, it's because that's not part of their treatment model. Their approach is to prescribe medication to manage symptoms and move on to the next patient. The system is built around time and money. More chronic patients mean more revenue for both doctors and the pharmaceutical industry. That's not to say that all doctors have bad intentions. It's just not how they are trained. The pharmaceutical industry pours massive funding into medical schools and has a clear financial interest in keeping medications as the primary solution. Now, I'm not saying that there isn't a time and place for medical intervention. There absolutely is. But I don't believe that our health should be as dependent on pharmaceuticals as it has become in today's society. Just as a house relies on a proper functioning circuit breaker, the body depends upon an unobstructed nervous system. If joint dysfunction occurs, it may reduce nerve signals, causing numbness, pain, or organ dysfunction. Chiropractic adjustments restore proper nerve flow, allowing the body to heal naturally. Whereas conventional medicine often manages symptoms rather than addressing root causes. For example, someone with high blood pressure, diabetes, high cholesterol, obesity, heart disease, etc., might take medication to cope with their condition as opposed to addressing lifestyle factors that may in turn resolve their condition. This symptomatic approach is akin to ignoring a structural issue in a building and simply painting over the cracks. Chiropractic care seeks to correct the underlying dysfunctions rather than masking symptoms. This issue is a major factor affecting public health. People have been conditioned to believe that being symptom-free is the same as being healthy. In reality, taking medication to control high blood pressure, high cholesterol, diabetes, or heart disease doesn't make you healthy. It simply suppresses symptoms. To truly resolve a condition, whether it's pain, high blood pressure, heart disease, or diabetes, you must address the root cause. Taking a pill to mask symptoms is like silencing your body's warning signals while the underlying issue continues to progress beneath the surface. For example, I've had patients diagnosed with prediabetes who were prescribed metformin instead of being encouraged to change their lifestyle. While metformin helps regulate blood sugar, it also decreases vitamin B12 absorption, which can lead to neuropathy. Nearly half of all diabetics suffer from neuropathy, and in some cases, even supplementing with B12 isn't enough to prevent it. Left unaddressed, neuropathy can worsen, leading to ulcers and eventually amputations. This entire chain of events could have been avoided by addressing the root cause, yet many people choose medication because it's an easier option. Now, I may have gone a little off tangent, so let's bring it back. Chiropractic care focuses on correcting the underlying cause of health conditions rather than simply managing symptoms, preventing them from silently worsening over time. You may be wondering, how does chiropractic work? To understand that, you first need to understand how the body heals. Imagine one of your bones becomes broke. How do you fix it? Well, your body is remarkable because it actually heals the broken bone itself. If the fracture you have is a simple fracture and not a compound fracture, it may not need to be set. A compound fracture is a fracture where part of the broken bone pierces the skin. This may also cause the risk of infection. A simple fracture may just be a break in the bone without displacement. Therefore, you would just need a cast to keep it still. Your body would naturally heal the bone by filling in the gap while you keep it stationary. Bones need to be immobile to heal properly, so bones heal when their motion is restricted. But what happens to the muscles around the bone? They atrophy. In other words, they weaken and shrink because muscles, ligaments, and tendons need regular proper movement to recover and stay healthy. When their movement is restricted or altered, they degenerate and get worse. Chiropractors work on every joint in the body, from the top of the head to the tips of your toes. Their goal is to restore normal motion to any joint that is not working properly. The motion restored through chiropractic adjustments is different from the everyday movements we're used to. What many people don't realize is that joints actually have 3 distinctive types of movement. Each is essential for maintaining and restoring joint health. The first type is active motion, which refers to movements that you voluntarily perform, such as exercise or daily activities. This type of motion is maintained by muscle activity and follows Wolff's Law, which states that bones strengthen or weaken based on the amount of stress they experience. This is why training is crucial, especially for aging individuals or those with osteoporosis. It helps maintain bone density and strength. Similarly, Davis' law applies to soft tissues like muscles, tendons, and ligaments, stating that they also strengthen in response to mechanical stress. This explains why astronauts lose muscle and bone mass in space. Without gravity's pull, their bodies don't experience enough stress to maintain strength. Simply put, if you don't use it, you lose it. The second type of motion is passive motion. This occurs when a joint is moved beyond its active range of motion using an external force, like when a physical therapist or stretch specialist helps extend a stretch. This is where physical therapy and chiropractic care differ. The third and most crucial type for joint maintenance and restoration is joint play, which happens at the physiological limit of a joint. Unlike active movement, joint play is an involuntary motion within the joint itself, such as sliding, gliding, or slight separation of joint surfaces. These micro movements are essential for normal function, allowing proper lubrication and nutrient exchange in cartilage. Without joint play, joints become stiff, lose mobility, and begin forming degenerative arthritic spurs as a compensatory response. So here's a quick review. Active range of motion is rehabilitated and improved by active motion, the motion that you do, such as lifting weights, walking, etc. Passive range of motion is rehabilitated and improved by passive motion, performed by a physical therapist, a stretch therapist, or a chiropractor. The third type of motion, joint play, is a type of motion rehabilitated, restored, and improved by specific chiropractic adjustments performed by a chiropractor. So why choose chiropractic over physical therapy? Chiropractic care offers several advantages over physical therapy, particularly when it comes to restoring joint function and providing fast, hands-on relief. Chiropractors specialize in spinal and extremity manipulation, allowing them to quickly address joint restrictions and loss of joint play, something most physical therapists are not licensed or trained to do at the same level. This makes chiropractic care especially effective for conditions like acute back or neck pain, headaches, and mechanical joint dysfunctions where rapid relief is desired. Another key distinction is chiropractic focuses on the nervous system and the structural balance, where physical therapy often emphasizes rehabilitation and muscular function. Chiropractic care considers how the entire system, joints, spine, and nervous system work together. This more holistic approach can lead to improvements not just in the pain, but also in posture, coordination, and overall body awareness. Chiropractors also tend to place a strong emphasis on long-term wellness and preventive care, encouraging regular check-ins to help patients maintain optimal function and prevent future issues. Additionally, many chiropractic offices operate on a cash-based model, which can offer greater flexibility and more personalized care. Without the constraints of an insurance-driven visit limits, chiropractors can spend more time with patients and tailor their approach to the individual needs. While physical therapy excels at progressive rehabilitation and strength building, chiropractic care is often the better choice when the goal is to restore joint motion, reduce nervous system interference, and support the body's natural ability to heal. Here's the key takeaway. Arthritis isn't caused by age. It's caused by time and lack of proper motion. A joint that loses mobility for just 7 years can already develop degenerative changes. You could have a 27-year-old with an arthritic spur from an untreated injury at age 20, while a 75-year-old with well-maintained joints may have no arthritis at all. So when people say, old age doesn't come alone, I call bullshit. Arthritis and most so-called age-related problems stem from poor recovery, poor nutrition, and poor mindset, not just the number of candles on your birthday cake. Getting back to chiropractic and how it restores joint play, let's look at an example in the spine, since that is probably what most people associate chiropractic care to. In your spine, there are little cushions between the bones called discs. These discs are crucial because they help your spine move and absorb shock. However, when a disc becomes swollen, it loses its ability to move properly, which means it doesn't get the nutrients it needs to stay healthy. This happens because discs don't have a direct blood supply. Instead, they rely on a process called diffusion, similar to how a sponge absorbs water on your kitchen sink. Without movement, there is no nutrient flow, and over time the disc dries out, becomes brittle, and weakens, potentially leading to what is known as a herniated disc. When a disc is swollen, the body responds with inflammation at the site of the joint dysfunction. Dysfunction simply means the joint isn't moving as it should. Depending on where the dysfunction occurs, the inflammatory process irritates the nerves and may cause pain. If the affected nerve controls an organ, that organ might start to show signs of distress, leading to disease. Interestingly, you might experience symptoms related to an organ issue without feeling any pain at the joint itself. In fact, Dr. Henry Windsor, a medical doctor, conducted research on diseases and their causes. He discovered a 100% correlation between disease and specific levels of the spine. All organs and muscles are controlled by the nerves that originate from the spinal column. So any issue with these nerves can impact the function of related organs and muscles. Improper motion of a joint is detrimental. Chiropractic care is designed to restore normal motion to affected joints, allowing nerves to function properly and helping the body return to a healthy state. This approach sets chiropractic apart from other treatments like physical therapy, massage, exercise therapy, and medicine. But chiropractic care doesn't stop there. It addresses the whole person, not just a single organ or system. Chiropractors focus on restoring balance, improving posture, working with weakened or tight muscles, restoring joint mobility, removing nerve interference, clearing joint dysfunction, and also take into consideration the patient's nutrition and state of mind. Chiropractic isn't a set it and forget it type of care. Our bodies are dynamic, constantly adapting to the demands we place upon them, which sometimes leads to injuries that cause disease. Chiropractic care helps address these injuries and prepares the body to better handle future challenges. We don't live in a bubble. We run, jump, work, play, and live our lives. Just like a piano that needs regular tuning, our bodies need periodic adjustments to stay healthy. That is why maintaining a healthy, flexible spine and well-functioning joints is essential for overall well-being, and this is where chiropractic care shines.